Have you ever been told your blood pressure is high, but no one really explained? I'm Joanne Lu, a functional medicine practitioner and a registered nurse. And today, we're doing a deep dive into hypertension or high blood pressure through three lenses: conventional medicine, functional medicine, and traditional Chinese medicine. My goal is not to tell you to stop medication or replace your doctor's plan. My goal is to help you understand that high blood pressure is not just a number, it can be a signal from the body. From the conventional medicine lens, blood pressure is measured using two numbers: systolic, the top number, and diastolic, the bottom number. According to the American Heart Association, normal is less than 120 for the upper number and less than 80 for the lower number. Stage 1, hypertension starts at 130 to 139 systolic and 80 to 89 diastolic. Stage 2 starts at 140 or higher systolic or 90 or higher diastolic. Severe levels above 180 or 120 need urgent medical guidance, especially if symptoms are present. Conventional medicine focuses on lowering cardiovascular risk: stroke, heart attack, kidney disease, eye damage, and heart failure. That is very important because hypertension is often silent. You may not feel anything, but the pressure can still be affecting your blood vessels over time. But here is where functional medicine asks a deeper question. Why is the pressure elevated in the first place? Blood pressure is not random. Your arteries, kidneys, nervous system, hormones, minerals, mitochondria, inflammation level, and stress response are all involved. So instead of only asking, how do we lower the number? Functional medicine asks, what is driving the number? One of the most overlooked drivers is micronutrient deficiencies. Your body needs minerals and nutrients to regulate blood vessel tone, fluid balance, nerve signaling, and cellular energy. When these nutrients are low, borderline, or not functioning well inside the cell, the body may have a harder time maintaining healthy vascular relaxation and blood pressure balance. Let's start with magnesium. Magnesium helps blood vessels relax. Think of your blood vessels like a garden hose. If the hose is stiff and tight, pressure builds up. Magnesium is one of the minerals that helps the vascular hose relax. The NIH Office of Dietary Supplements notes that the FDA allows a qualified health claim that consuming diets with adequate magnesium may reduce the risk of high blood pressure. I don't present magnesium as a magic cure. I present it as a foundational nutrient that deserves attention, especially when someone has stress, poor sleep, muscle tension, constipation, palpitations, or a diet low in magnesium-rich foods. Next is potassium. Potassium works closely with sodium. Many people hear the word salt, but they don't hear enough about the sodium-potassium balance. Potassium supports fluid regulation and helps counterbalance sodium. When the diet is high in processed foods and low in fruits, vegetables, beans, and mineral-rich foods, that balance can shift. In functional medicine, we don't just ask, are you eating too much salt? We also ask, are you getting enough potassium-rich whole foods? Of course, people with kidney disease or those on certain blood pressure medications must be careful with potassium. So this is not a blanket supplement recommendation. Then we have CoQ10 or coenzyme Q10. CoQ10 is involved in mitochondrial energy production, and your heart is one of the most energy demanding organs in the body. When I think of CoQ10, I think of cellular energy, especially for the heart and blood vessels. Some research has looked at CoQ10 and blood pressure support, but again, this is not about saying one nutrient replaces medical care. It is about asking whether the body has the tools it needs to function well. Another nutrient I think about is vitamin D. Vitamin D is not just a bone nutrient, it also interacts with immune function, inflammation, and hormone signaling. Low vitamin D is commonly seen in people with metabolic issues, but vitamin D should be tested and monitored because too much is not better. Then there is B vitamin status, especially when we are thinking about homocysteine, methylation, energy, and vascular health. B vitamins like folate, B6, and B12 support many pathways related to cardiovascular function. This is why I like to connect the dots between fatigue, neuropathy symptoms, medication use, diet quality, and cardiovascular risk. Now, let's talk about insulin resistance, because this is a huge part of hypertension that many people don't connect. High blood pressure often travels with blood sugar issues, belly weight, fatty liver patterns, high triglycerides, PCOS, sleep apnea, and inflammation. When insulin is high, the body can retain more sodium. Blood vessels can become less flexible, and inflammation can increase. So, if someone has hypertension, I'm also thinking, what is their fasting insulin? What is their A1C? What is their waist circumference? What is their triglyceride to HDL pattern? What happens to their energy after meals? Stress is another major piece. When your nervous system is constantly in fight or flight mode, your blood vessels may stay more constricted, your heart rate may increase, and your body may hold tension. This is why I always say hypertension is not only a heart issue, it can also be a nervous system issue. Chronic stress, poor sleep, trauma, caregiving burden, night shift work, and emotional exhaustion can all show up in the body. Then we have inflammation and oxidative stress. The lining of your blood vessels, called the endothelium, needs to be flexible and responsive. When there is chronic inflammation, oxidative stress, smoking, high sugar intake, poor sleep, or nutrient depletion, the blood vessels may become less flexible. And when blood vessels lose flexibility, pressure can rise. Now, let's bring in medications, not to criticize medications, but to understand the full picture. Blood pressure medications can be life-saving and necessary. But in functional medicine, we also ask what nutrients may be affected over time. For example, diuretics can influence electrolytes like potassium and magnesium. Some medications may affect CoQ10 or other nutrient pathways indirectly. This is why medication reconciliation should not only ask, what are you taking? It should also ask, what might this medication be depleting or affecting over time? From the traditional Chinese medicine lens, hypertension is not understood the same way as conventional medicine. TCM does not diagnose hypertension based only on the numbers. It looks at patterns. A person with high blood pressure and irritability, headaches, red face, and stress may be viewed differently from someone with high blood pressure, fatigue, heaviness, poor digestion, and fluid retention. In TCM theory, patterns may include liver yang rising, yin deficiency, phlegm dump accumulation, or deficiency patterns. I discuss this from an educational perspective. What I love about TCM is that it reminds us to look at the whole person, not just the reading. So when we bring the three lenses together, here's the bigger picture. Conventional medicine protects you from danger and helps you manage risk. Functional medicine investigates the root contributors, micronutrients, insulin resistance, stress, inflammation, oxidative stress, sleep, medications, and lifestyle patterns. TCM gives us a pattern-based way to observe how imbalance expresses itself in the body. My biggest message is this: high blood pressure is not just a number, it is a signal. And if we only silence the signal without asking why it appeared, we may miss the deeper story. For some people, the story may be sodium and stress. For others, it may be insulin resistance. For others, it may be low magnesium, poor sleep, inflammation, or medication-related nutrient depletion. And for many people, it is not one thing. It is a pattern. So, if you have high blood pressure, don't ignore it. Monitor it. Work with your licensed healthcare provider. Take medication if it is prescribed and appropriate for you. But also ask better questions. What is my magnesium status? What is my potassium intake? What is my blood sugar pattern? Am I inflamed? Am I sleeping? Am I stressed? Am I eating enough mineral-rich whole foods? Are my medications affecting nutrients over time? This is the kind of deeper conversation I want my patients. Not fear, not shame, not just take this and don't ask questions. But education, investigation, and a clearer understanding of what the body may be trying to say. If you are wondering whether micronutrient imbalances could be part of your blood pressure story, this is where testing can be helpful. I offer micronutrient testing through my practice at Bay Area Functional and Integrative Health. You can learn more at joanlu.com, joanlu.com, and use this information to have more informed conversations with your healthcare provider. Again, healing starts with investigation.